Health Talk, brought to you by Rapides Regional Medical Center. Spencer DeCuir knows all about hard work. He spent 34 years working offshore to provide for his family.
And it don't get no harder work than that.
About the only thing to slow Mr. DeCuir was kidney disease. Then one day, his blood pressure became irregular.
She took my blood pressure and my heart rate was up real high, so she called a neighbor that's a EMT there or whatever, and he came over there and he checked it, and he called his boss and said, well, you better get him to the hospital.
Mr. DeCuir needed a new heart valve to replace a defect in his aortic valve. However, due to kidney disease, he was not a good candidate for traditional open heart surgery.
We had to go through CMS accreditation, which is with the government. At that point, we had to follow a strict guideline of how many open valve cases that we do here in this hospital. We had to meet criteria for that so that we would be able to move forward with doing the TAVR procedure.
Mr. DeCuir was the first patient to undergo transaortic valve replacement, or TAVR, at Rapides Regional Medical Center. TAVR is performed in a cath lab setting, and often patients are able to go home in a day or two. For Mr. DeCuir, the less invasive valve replacement allowed him to take part in his 50th wedding anniversary celebration, held just 2 weeks later.
I feel good now, you know. Oh yeah, overall I'm doing excellent.
For more information on transaortic valve replacement, visit rapidesregional.com.